You have always supported us in our health programs. You have always supported us in our health programs. And because of you, we know we can continue to provide quality health care services to all persons living in Greater Accra region at all times. One of the major battles when it comes to healthcare delivery that we've had to battle with has been the issue of malaria. And malaria, as we know it, has been one of the serious infections which has had negative impact, health impact on both the young, the adolescent, the aged, the vulnerable, like our pregnant women. But we also know that throughout the past, so much has gone on to ensure that, you know, with time we are able to address these issues of malaria, and it will no longer be a threat for us. And this year we've come back again, and we are saying our theme for the year is Zero Malaria. We want to get to a point where malaria is not a cause of death or even serious admission. And we can only do that by adhering to all the different, you know, protocols or strategies that have been put in place. You know that one of the strategies that we have been embarking upon since 2003, with support from Ghana Health Service and our health partners, have been the distribution of long-lasting insecticide-treated mosquito nets. In the past, the emphasis was on the vulnerable, you know, the pregnant women, children under 5. This year we are saying that everyone, the entire populace, everyone living in Greater Accra region is supposed to, you know, have access to a long-lasting insecticide-treated nets to ensure that we break, you know, contact with the vector. It's one of the major strategies for vector control that the entire Ghana Health Service, National Malaria Control Program, as well as our health partners have been embarking on. So the purpose of this stakeholders meeting this morning is to let you know that once again we are starting the program. It is going to take place in all the 29 districts of Greater Accra region and all the 133 sub-districts in Greater Accra region. It started from yesterday, that is starting from yesterday, which is the 8th of November, through to coming Sunday, which will be 21st of November. We started registering households. This time, you know, the distribution is going to be to all households, and we are using the universal coverage, pardon? Yes, we are using the universal coverage principle that says that at least 2 persons in a household must have one long-lasting insecticide dead net available. And to be able to do that, it means that we now have to register the households to know how many households that we have. For this particular exercise, based on the data available to us, we are targeting a little over 1.5 million households in the Greater Accra region. And we have over 3.4 million bed nets, insecticide bed nets to issue out. But then how do we go about it? Like I said, from Monday 8th November, from Monday 15th November through to 21st November, where we had staff, some of our people going around the households, you know, registering all the households. We are pleading with everybody This is a Ghana Health Service accepted program. When they come, they will identify themselves with a Ghana Health Service identification card, which they hold. If they have it, please let them into your household. When they come, they will wash their hands. If you make it available, they wash their hands with soap and running water, or even use the hand sanitizer that has been provided for them before they even start to interact with you. At the end of the day, they are registering to know how many persons are in the households. We will be looking at, a form of identification. We accept the voter's ID card, we accept the national identification card, and then we yes, and then we also accept the NHIS card. If you have any of it, they will also take your telephone number and a few detailed information, which they will capture it straight into the software that they are holding. Once they capture all the necessary information, immediately they submit. A unique code will be generated, and that code will be given to the household, so that when it is time for you to come and redeem your mosquito nets, long-lasting insecticide mosquito nets, which will be relayed to you at the appropriate time, you can come to the collection point with a unique code that has been given to you, so that you collect your mosquito net. Please know that if you don't provide the information, or you don't let us have access to the needed information, you cannot be registered. If you are not registered, you will not have a unique code. If you don't have a unique code, you will not get any of the long-lasting insecticide treated. They are free. We are not charging for it. Nobody is going to take anything from you. So our purpose here this morning is to talk to all our friends, our stakeholders that have gathered here, so that as you go back, every district, we want the assemblies, we want the NGOs, the civil society organizations, and everybody who matters within the district to claim ownership, own it, and help us to ensure a successful distribution. We are hoping that the distribution will also be for 1 week, from the 8th of December to 15th December. But whatever time it is, you will get the alerts on your phone when we are ready for the distribution, because remember, we are taking your phone number as well. If the head of the household on the day of collection, you cannot go yourself, and you give the details to any member of your household, he can go and redeem your mosquito nets for your household on your behalf. And not only are we distributing the long-lasting insecticide treated mosquito net, but we also want you to help us to encourage everybody who receives one to use it. Let us sleep under the Oh, okay, thank you. Let us encourage them to sleep under the nets, so that together we can break transmission of malaria, and we will get to our target of zero malaria in the region. Under no circumstance should malaria be a cause of death for anyone in this region. So we count on you for a very successful campaign, as well as a very successful distribution when it is time. Thank you very much, and I'm grateful.
Achaminana afiyu osayo netonono enyo neji osudoku simpin manye monoligbino program no ne wabaneji malaria program no wabakasio loji bua Johnson ne ke han mi ne maso kan ke iya made nana dokua amponsa neji paramount queen mother kan ha osudoku ma chope ma piehe nike ke manye menapie wa mape kake wa machabonya de o ma fie kan ha osudoku ma benepene hioneji malaria wa G.H.S kura ngemam pio ne hiomionge neyo hio ifu ma je pokeba ne maso kan bene mo no ibakase no makaya ne ma de ma biome ne wo chope wa pekake ne wa ka je hio neji chapi malaria pe se elephantiasis kani mono wabakase ni ifu no makpa ma biome pe pio ne hiomionge ne kemo no yagmo otokota odra fine no wo otade ko ya no ba obomode no ba kambe ne pene mua wan me akosem ya ka mua wa me na ke malaria hin bayone no mono ligwino ma pa ma bioma pe ko ne wo chope wa pe kake ni wakaje hiyo ngema netum
achomina adole ablade ni jikenkene hiyo manye sempe new town kesukura Germany chimi ambe no koke mocho fe no ni bakase ni efi aka kante no aka ni bebe ni ewo be mabote jalami nka ma na sanigba aka ekwo ehin ame ka wiemo bia ne fichi hogba mo fi mo yehia ewo mo ka ba so mo yamna no ba eja ka ogba ji na agba na anya register emaya clinics ni yon kuchuemi koni many ba hospitals kan bi ehun ana me ka wiemo ke chomo agbene hu ma yi ngongo no koni aka chose man bi fe koni amefi ame ya available koni anyeni aropa amefe into what we've discussed here na agbe kura hu entwa me ni bi na ba need ni abanye ni aka register kaji ohie ne ka identification na kokura go yin na register mo fe boni ji ka ba register ka ha kuni ohia o household amen le ba share ko ma na ameli akashi esa ni no imujin ka ni bi ka fie o ba shi o momoshi kanyombo ne ne bote ni bi ami esa ni wo chi wo hwe fale femo ekun malaria na shikaji oye shia ni okamuji dwe ma shi owo ewo tontron kani bi no mefien ka hilanyi wo ka wonye wo pe oba fo ni bi ahi dwe oba han dwe ashi oba ba atuni oba sa o shin le efefe malaria kai bapo enyen emobu enyen efe noko wo agbene ko nu pa mi aka echi bo ba doctor koni akwebu kana kan loko ba ma bo chofa keken ekun
actually greater encouragement Directorate. Then I paid one a long-lasting insecticide treated net by no way fam. Lord, no I paid ni mamba ni we am. Amapi mo obie ni menang riomi. Benini ni si him ne ha. Papa ni pesa ni aka. Yetu anopale information ni maha. Lord mama yeke ha net so ne. Ni kaje here lady 15 kata ko bane mano lady 1 week ko e mana ni na he ID card for the Ghana Health Service ni yewe ani aba ni hame ni ne sanali wanyanye ID card, voters ID card, national health insurance card and national ID aloini valid ID fen ko no no wamaye wakama hamu code the case una magnet code no kuma net ne wachobo wale bene malaria pio wo hanwe wa manomi wasihemu nyune mansinge hepo kemu keni wa kani pesa minya wa wendram bem ke wa wendram wa mafanye pesa minya na wa maye wasihemi beno adra wa wenha milk pompo ti tomatoes pompo keni lo ade masine nyumbani lo mena wo pom na ke malaria ke yore keni mbani wanganye deka keni omeba na ma registration of payment nye hema wa tu ke banyewe ami nini ha menu na ke fuade alopo me sanitizer sanitize ila kan wale nka covid o mu in still no registration ko register we obenet ona apanye be ye register kenye ID card kenu feno
na koko ajuyi advanka manye niji kenkne o mwene mbakasi akeke hime ye me ke no fia na ba mo fia mo ekomi first a feel naka ene le achaki mi aka feel naka e wo mi pa fa keke me bachia ame ni bi ye ni atawo fen ogbe money di onu pa ye chia ame telephone number ke ni bi fen e wo ne ka wote wo ma mi wo ba wi won na ka me fe na ka eja ke last na ba ja ye wo community e fe be ke no mo wa che police ba do mo shi dani ehi no mi ame register ko sha me ke do ame internet eja ke Ghana no ni e wo bona wi ne wo ba ya wo ka assemblyman ne ba fi ko ni what share your community ekeni ke heni abajaye ti wo we kuchi an wo ba ya je ni wo ka ma ayu ekeni